Hello everyone, my name is Eileen Rocard and I'm here at the European Health Forum Gastein. I'm here as a young Gasteiner and I'm really happy to be here with you, Sonja Wehsely. You're from Siemens Healthineers. Before we dive into the questions, can I ask you to briefly introduce yourself?
Thanks a lot for having me. I'm at Siemens Healthineers and I'm responsible for a geography. That means for Central Eastern Europe and Central Asia, that's about 30 countries, very diverse countries, countries with a European Union legislative and others as well, so always very interesting.
Thank you so much. The first question is really about the technologies, AI technologies. Given that AI is a fast evolving field and there is a growing influence of AI, so with the growing influence comes the responsibility. And how do you ensure that the technologies are trustworthy, accurate and relevant?
Well, on one hand, it's important that as a company you have a legacy in this field. So at Siemens Healthineers, we have about 90 applications already running. And we ever should have in mind that, that AI is a tool. AI is a tool to increase the level of diagnosis and patient outcomes. And what we need on one hand is really smart people working on that, a close collaboration with the users, because an innovation really should help to make the healthcare system better. And we need good regulations, because it's all about trust. The data are owned by the patients or by the people. And if we want the data to develop new tools, then we need the trust. And therefore, good companies, good regulation, good people.
Yeah, perfect. Actually, this is a perfect transition to the next question that we had in mind, and it's about regulation. There is a context. Most of AI innovation is happening in the US, and well, in Europe, we are regulating AI with the AI Act that you know very well. So how do you balance the need between fostering innovation while complying with the EU regulation and the market, the EU highly regulated markets?
That's a very, very important question. So I only can echo, also our company is doing most of the AI innovations in the US. I think we have the diversity, because if you do it close to New York, you have the entire world there. But that does not really answer your question. It's a lot about competitiveness for industry in Europe. And therefore, on one hand, it's very important to have a clear regulation and also a very strict regulation, because it's about trust. And there is nothing higher than and more important than health. On the other hand, it has to be practicable, that we don't shift innovations from Europe to other parts of the world. From my point of view, it will be highly be dependent on the question how the AI Act will now become reality. Because in general, it's a great idea. It was also not focused on medtech, and therefore it's in some cases not really fitting there, because we already have an MDR regulation and we have a vertical regulation where software is already in, and it mentioned before, AI is a tool and not a miracle. Yeah? And therefore now it's about working on how will be the outroll and the reality. And to sum it up, strict regulation is important, but the European Union also has to have a big focus on not losing competitiveness.
And the next question is actually related, and it's about secondary use data. So basically, we need secondary data to be able to make progress and to progress AI in AI. But at the same time, we need to ensure that we protect patient privacy. So how do you balance the two needs in Siemens Healthineers?
Well, from my point of view, currently, of course, we have the GDPR, but European health data space is around the corner. And there is a very clear is maybe too positive. There is a definition where secondary use could be put in place. There are some wordings which are not clear enough and could make it too broad, which then would lead to not using data for secondary use, which would be very, very important for patients and for development of new tools. And therefore also here it's very important that on one hand we work together, on the other hand that the way how the European health data space will be put in reality, that's the kind of lakmus test, yeah, to see if it works or not. What I think is very, very important to have an opting out standard there. And I can compare this with the e-health regulation in Austria, where there was a long political discussion if it should be an opt-in or opt-out discussion. And if you really want to generate data for the use for scientific use, you need the opt-out, because otherwise you will not succeed with really collecting the data. So let's see, I'm still positive, but we are not there now.
Not yet, maybe.
Yeah.
Okay, we have, to wrap up, we have one last fun question. And the question is, if AI had a superpower, what do you think it should be in healthcare?
It should solve the biggest problem in whole healthcare, and that's the lack of qualified staff. And as mentioned before, AI is not a superpower, it's a tool. And I really hope and also see that AI could be used for changing processes, for driving change management, for driving the way healthcare is delivered, because a bad process, digitalized, is a bad digitalized process. And there AI will not help. Therefore, in one sentence, AI should solve our staff shortage problem.
This is an excellent answer. Thank you very much.
Thank you and have a great time in Gastein.